the present and the future of medical reality. This new branch of medicine that we're all here to think about and learn about. And our goal for this 2 days is to advance this conversation and come out of these 2 days with some new ideas for how to move forward with the metaverse and medicine in the metaverse. We have an incredible audience here today. We have over 370 registrants from 17 countries. We have over 50 universities and hospitals represented in the room today. We have pediatricians, we have internists, we have surgeons, we have patient representatives, pharmacists. I'm going to run out of stakeholder names, so I'll stop there. But you know who you are. This is a very mixed and diverse audience. We have an architect who will be speaking later. We have an interdisciplinary conference. I think that's today or tomorrow, I forget. Incredible array of different people in this room because this is science that we're here to discuss. So we have a lot to get to, so I'm just going to get to it. And I'm going to start with this image, which I've been showing since we first started this conference in 2018. And I really like this image for many reasons. All of the patients, by the way, who are pictured have provided their consent to be pictured. The reason I like the photo is she's not smiling. Okay, this is not a picture of somebody, a 20-year-old teen playing first-person shooter games in their parents' basement. It's really about gaming and entertainment. We are all here because we believe in the power of games and serious games, but what we're talking about is not first-person shooter games. We're talking about people who are vulnerable, people who are suffering, who are in pain, and trying to figure out how do we interface technology with this biopsychosocial illness experience that we all will experience in our lives at some point. And what is the science behind that? What is the regulatory framework around that? What are the research agendas that we need to follow? That's what we're here to talk about. So when people outside of a room like this see headsets like this, they don't necessarily immediately think of medical and healthcare applications. They think about gaming and entertainment. That's sort of the zeitgeist out there right now for MXR, or medical extended reality, which is not a term anyone's heard of outside of this room for the most part. And we need to change that. Now, it's been over a year since Mark Zuckerberg made this announcement when he explained that Facebook was changing its name to Meta, and that was a big deal. We now know that the metaverse is coming. This is going to be the new future of the internet, where we experience digital content in spatial three-dimensional computing, where we engage and live with one another in these virtual worlds. We're going to have a discussion by Kent Bai, who has an incredible background in philosophy, to discuss whether we're living in a simulation right now. Okay? That is a reasonable question. Okay? And so one key finding from his line of thinking, and people like Chalmers, is that virtual realities are genuine realities. They're not second-class realities. They can be first-class realities. So he's going to talk about that, and we'll get to those details later. But whatever you think about this, the metaverse is coming. This is a book by Matthew Ball, The Metaverse and How It Will Revolutionize Everything. We'll see if it revolutionizes everything. Some people, when they see this, they think about dystopian futures. They think about Ready Player One, a great book, good movie. My next-door neighbor wrote the screenplay for the movie, so I have to say it was a great movie. And, you know, the problem with this, of course, is the dystopian future where people are not living in real reality. They're living in virtual worlds, disconnected from one another. But our goal here is to recognize this is happening. We create a Medi-Verse, M-E-D, from within the metaverse. And this is a term that Daniel Kraft coined, and he'll be speaking later today. And so how do we cultivate some corner of this metaverse to support human health and well-being? What does the recipe look like for that? Well, one thing I want to point out right up front is this field is legitimate. This field is expanding massively. In just the last few years since we started this conference, there has been an exponential rise in the number of peer-reviewed papers that involve extended reality and virtual reality in healthcare. Just last year alone, there were over 3,000 studies published in the peer-reviewed literature. Now we have over 18,000 studies that involve the use of virtual reality in healthcare. So this is not a fringe anymore, not even close. There are meta-analyses now, and meta-analyses upon meta-analyses for using virtual reality for acute pain and chronic pain, for example. If you type into PubMed, meta-analysis and virtual reality, you're going to find meta-analyses on dementia care, on physical therapy, on surgical training. So when folks say, hey, this sort of sounds experimental, I say, not even close. It's not experimental anymore. It's real. There's a lot of work to be done, but we have over 18,000 studies now, and many of you have contributed to that literature. So we've been doing this for a while now at Cedars-Sinai, and you can tell because this image, which I often show, has a Galaxy S7 phone clipped into a Samsung Gear VR headset. It's literally laughable now, right? But at the time, this was crazy to do something like this in a hospital. And I always show this image because I find it so meaningful. That moments before we took this image, he was doubled over in pain from sickle cell anemia, with pain in his long bones and in his chest. But at this moment, he is flying over fjords in Iceland. And you can see the emotional response on his face. And that's the first key lesson, is that emotion matters. And so what I mean by that is if you think about your own life, if you think about the experiences that you've had and the memories that are most powerful to you, both the positive and regrettably the negative, they're almost all forged in this crucible of emotion. That's what creates the memory. That's what burns the memory into your limbic system, right, into your hippocampus. It's the, hey, Skip Rizzo. I just see you right there. You shut up. I got to stop mid-sentence to say hi to Skip Rizzo. Okay, hey. We'll hear from him later. So this is how we remember things. This is how we change our mind. Okay, there's a lot of talk about how to change minds, whether it's politically, psychologically. It's through emotion that we change our minds. That's how we change our minds. And so this is the power of VR. A reminder to all of us why we're here is it's unlike any other audiovisual medium because of this sense of presence that it delivers. This feeling as if you are literally in a helicopter flying over fjords in Iceland. Even though intellectually, I'm sure he knows he's not literally in Iceland, his brain doesn't care. It's just assuming it's there because we never evolved to live in two realities at once. We don't have that neurological machinery to disambiguate which reality we're in at any given moment. We have to actually think hard to kind of disambiguate from the reality that we're in. This is a recent image with Omer Liran and I, and we're using virtual reality, one of well over 3,000 patients now, who you'll hear more about over the course of the 2 days, how we run our virtual reality service at Cedars. And here we're watching on the computer screen, monitoring her heart rate variability, her pupil diameter, and her cognitive load through this Omnicept headset. And we're monitoring to see through biofeedback, is there a physiologic response to the therapy that she's experiencing? But one thing I really find meaningful about this image are the cables in the foreground. It's almost as if there's a metaphorical jail that she's within. It's a hospital room, but we all know that this is not a place of rest or a place of healing. The hospital is a biopsychosocial jail cell. Okay, that's what it is. It's a place of physical suffering, of emotional suffering, and social suffering, all at once in a hospital room. So to give her the opportunity to escape those four walls, both physically and sort of metaphorically, to escape the four walls of her mind in that moment, is profound. And so I'll show you a video later of her using virtual reality and her reaction to it. Because it's one thing for me to sit here and show pictures, but it's another to hear directly from our patients, which is why we're going to be hearing from our patients, including Harmon Clark, who's right here in the front row. And when he comes to the hospital, and he'll tell you more about this tomorrow, one of the first things he asks for, I think it's fair to say, Harmon, is virtual reality headset. Where's the VR team? I want you to be in the hospital less, but when he comes in, I get a text real quick, and we're straight up there. Our number one VIP gets his VR headset. Well, he'll tell you more about his own experiences. One thing that really stuck with me is he loves to go into these nature environments or to go into outer space and look back upon planet Earth. And there's something sort of awe-inspiring, literally, about looking back upon the planet. And this is another key message that we're going to hear about. I think Terry Yarbrough is here. Yeah, I think you're going to be talking about awe, so I won't steal your thunder. But awe is a very powerful emotion, the sense that you're in the presence of something greater than yourself, a transcendent feeling. And there's been amazing research that will be summarized later about the power of awe and what it does to the nervous system. One of those things you can literally measure is goosebumps. This is a biomarker of awe. Not everyone gets goosebumps, by the way. I'm going to guess most of the people in this room get goosebumps, which is why you love conferences like this. So this is a study from Simon Fraser. Are you awed yet? How virtual reality gives us awe and goosebumps. It was a study out of British Columbia. I'm not sure if anyone, I know we have some folks from BC here, where they took participants and flew them over the city, Vancouver, then over the Canadian Rockies, and then launched them straight up into outer space, where they then looked back down upon the Earth. And as they were doing that, I've never seen this before, there was a goose cam on the forearm monitoring goosebumps. And so they were able to objectively measure the neurologic response to this experience. And they were able to demonstrate this cause and effect immediate response. As an aside, it tended to be a little more common in women than men, they reported. Take that for what it is. But also this very strong subjective sense of empathy that went along with the physiologic shivers. So these are 3 principles I want to start with as I frame the next 2 days. And I'm focusing right now on the therapeutic, but this applies just as much to training of surgeons as it does to educating patients and providers, is doing it with a sense of emotion, escaping your immediate environment, and achieving some sense of awe, that you're in the presence of something greater than yourself. And so I want to show you now an example with one of our patients of those 3 pieces coming together. And this is a video of a patient who's in the room, but not pictured. But her name is Julia Monterosa, and she's allowed us to use her name because in this room there's a reporter from the New York Times who wrote an article in the Sunday Times about the video that you're about to see. So you can read the New York Times article about this video. And Julia was very gracious to be interviewed for this and on a wonderful piece on Univision that she filmed recently. So she has irritable bowel syndrome, and we have some gastroenterologists in the room, Brian Lacey from the Mayo Clinic, Linda Nguyen from Stanford, who will be talking more about some of the opportunities to use VR for chronic abdominal pain, irritable bowel syndrome, dyspepsia. And so she has irritable bowel syndrome and has received a number of different treatments, pharmacotherapies, has received antibiotics. That didn't help her. 6 months before we shot this video, which I'll show you in a second, and I'll explain why we're looking at 2 computers, she lost her son tragically in a car accident. For me, because it was very hard to watch her go through this. Because when she came in, she was in such distress. You can just see it on the physiologic data here on the left. This is her data, or biodata. And she was in distress and upset and crying. And so we started this experience because she wanted to be on the beach. And there's a mandala expanding and contracting. And this is just astonishing to me because you can see what happened here. As soon as we started the virtual reality, she was essentially hypnotized. I mean, just hypnotized, like she was out. She was awake. We could see that because we can actually measure her pupils. Okay, so she had her eyes wide open, but she was, this is her cognitive load. So this is an integrated measure that accounts for the heart rate variability, the pupillometry, the heart rate, eye tracking, an integrated metric, unitless, that gives you essentially a sense of how hard the brain's working, we'll call it. Maybe it's a measure of flow state. But right about here, she started to cry, which is why I'm holding back emotions right now. And she said she was in heaven with her son. Right about here, she said that she was with God. But thank you. So, again, you can read about it in the New York Times, but we took off the headset, and she was crying, and I was holding back my own tears, trying to be very clinical about the whole situation. But she said, I have no pain. She said, it's like gone. Her pain is gone. And we said, what just happened to you? Your pain is gone. You've had nothing but pain and suffering, and just now you're telling me that you're with God, and you have no pain. And so we talked about that, and we said, we haven't cured anything just yet, but something's going on in your brain. And we talk about this with our patients, and we have a script that we follow. And it goes something like this. I'll say, your brain is not like a block of Play-Doh rattling around in your skull. I mean, it is a shape-shifting organ like any other organ in your body. It is capable of changing rapidly, actually. We have connections within the brain. This is Adam Ghazali's glass brain, famous glass brain. Adam has spoken at this conference before. And we say, listen, even if you have inherited a body that's betrayed you, right, a body that we try to fix with surgery, we try to fix with medications, we can't always fix it, and it's not so straightforward. The brain and the body are connected. Okay, this old Descartesian notion that there's mind and body and they're separated and distinct, it turns out it's completely inconsistent with modern neuroscience. It's one continuous system. So the point is that even if your body has betrayed you, we can still modify how our brain experiences our body. And that's a profound realization, and it's an aha moment to recognize that. And what I often say is, it's like you have a supernatural ability. And I don't mean that in some voodoo sense or woo-woo New Age science sense. I mean it literally. Okay? It's natural because we didn't inject a medication. We didn't put a needle in a joint, right? You just got this virtual reality, and now you're telling me that you see God and you don't have pain. So this was natural, but it's supernatural. Super as in above, right? Above, super. This is a level of consciousness that you're not normally operating within. It's above your normal level of consciousness. So you have to now recognize that you have this supernatural ability that you have to now learn how to reach out and pull back down. And that's the aha moment that doesn't cure the disease, but provides the initial powerful insight that you do have this capability, and now we have to work on it. Okay? So I show this slide a lot, and I lecture about this a lot. But I had to personally experience this myself recently. Not a happy picture of me January of this year, and I am holding my side. And I decided at this moment I'm going to put this into my lecture, so I'm going to take a photograph of me suffering. I won't show you what's underneath that, but underneath that is a patch of vesicles and the T7 distribution running all along my side from shingles, which I unfortunately got as a consequence of COVID. And if anyone here has had shingles, you know this is a pretty terrible disease. And when the pain transmission system itself is inflamed, that's a new kind of pain that I've heard about, I've seen, but I had not experienced myself. And it went on for 5 weeks. And I got to the point where I didn't know what was going to happen. And I wrote this at the time, as a doctor. I learned about shingles in med school. I read about it. I've diagnosed it. But now I have it, and there's nothing like experiencing an illness to really know what it's like. So I didn't know how long this was going to go for. And I knew about examples of post-herpetic neuralgia, which go on, unfortunately, up to 20% of people for months or years. And so I reached out. I saw my doctor. This is a of some of the treatments that I used. Everything from spray-on, that was probably the most effective of these things, was the simple CVS spray-on distraction therapy. That's a form of virtual reality. It's fooling me into thinking that everything's okay. I get a little gabapentin. I don't know. That just made me sleepy. Then I had to sleep, and I had all sorts of gels, and let's put some lidocaine on there. At one point, I'm like, he's like, we can just do a nerve block and knock this thing out. I'm like, a nerve block? It was very hard to concentrate, to go to work. The shirt just touching the skin was enough to just set off a fire in my chest. So I finally realized, wait a second, don't I do virtual reality research? So I finally it took me several weeks before I'm like, I think I need to start changing my brain around this thing, because this is getting to the point where I'm starting to really get a little desperate. That's maybe too strong a word. Note to speakers, don't trip on this thing. So here I am, and I'm naturally kind of putting my hands up. It was not like I posed this. I just sort of found myself naturally putting my hands up upward towards the sky. It's a very common pose, kind of a natural pose. And so I started using virtual reality. And this is Trip VR. Trip is here. Nanea's in the back. There's Nanea. Yep, there's Nanea. Oh, she's recording this too. Hey, Nanea. So this is me actually using virtual reality. And I was going through these fantastical cyberdelic worlds. I have the version of Trip where I can see my family, and photographs of my dog would start flying by, and it's just very heartwarming to be inside of this environment. And I wrote this tweet. I often lecture about the science of mind-body medicine, but right now I'm experiencing the theory firsthand. Earlier I was in distress from shingles, but now I'm in VR. I feel calm without pain. But then I wrote something that I really reflected on since then. I said, it will return in time, but I have the power to push it back. And that was that sort of aha moment where I realized that, this knowledge that I can now try and push the pain back, even if it persists, is sort of the nature of hope. I mean, this is what hope really is when you feel desperate. Yeah. And you don't know what to do, and then you find a way out. And so it was incredible to me that this headset was 100% more effective than all of those medications combined. 100%. I took that thing off, and just like Julia Monterosa, who also kind of looked up, I felt myself looking up and thinking, if this continues, I'm just going to deal with it. I'm just going to figure out how to manage this, because that's all I have, okay, is my own brain and my experience of my nervous system and my body. And I'm going to train my brain, top-down control of my nervous system, and that's what I'm going to do. And that was the insight, and that's powerful. Now, there was another experience that I've had. Some of you know where this is. Do we have any burners in the room? Oh, I knew it. I totally knew it. Yeah, okay. So Omer invited me to Burning Man, and I had the same idea of most people have not been there, which sounds like a psychedelic-fueled crazy party in the desert. And it definitely is. You could turn up the music on this, by the way. You could turn up the sound on this. So I took some videos of what was going on out there. I mean, it's insane. I mean, it's absolutely insane. I didn't know that humanity, like a collective of people, was capable of doing this. In the middle of a desert that's like Tatooine or something from Star Wars, 103-degree weather, we're intense, we're pooping and disgusting, it's horrible. But it was amazing, right? There I am, I don't even know what I'm doing. I'm just out in the middle of the desert. EDM concerts, right? There's that brontosaurus, just like going in the middle of the desert. It's crazy. Yeah. So, but in the middle of all this, there's this thing. It's sort of set aside. And I actually found myself I'm going to try through this part. Spending most of my time, not most of it, I was also at the EDM concerts. I'm a beatboxer, as we may hear tomorrow. But this is where you go to sort of get away from that craziness, and it is almost like defined by the craziness. Like the incredible exuberant happiness stands in stark contrast to this memorial where you go inside and you memorialize loved ones, whatever you want. You just sort of sit there and think about it. This is a collection of images and pictures that people have put on there. And so I wrote this on the wall. I said, my cousin Terry, this is the part I'm trying to cry about, we lost her, and she used to call me Boogie Woogie when I was a kid. And so this is a video of me showing that, and then you can kind of hear in the background, let me turn the sound a little bit, this EDM music surrounding us. But in here, there's this absolute quiet. There's a lot of people milling about. It looks like the cantina from Star Wars or something, but I didn't get the dress code. I didn't get the memo for the dress code, by the way. I was not prepared for that. I was just in like shorts and stuff. But these guys are like straight out of Star Wars. But I sat there in the middle of that sort of meditation circle, on that final night for 5 hours, saying absolutely nothing and just thinking. And I realize it's at moments like that, at moments of sort of vulnerability and solace and despondency, really, that, the cacophony around us, that sort of stand in stark contrast to the exuberant heights of humanity that sort of carved out this space when people most want a way out. And I looked up at the ceiling, and I saw this wide open space. Beyond it was the desert sky and these sort of twinkling stars. And no, it was not on psychedelics. But I looked out there, and I saw this beautiful space. And I noticed all of us were kind of looking up at it. And I saw this sort of object sitting in the middle, and I noticed it was suspended by these cables. And I imagined them as massive rubber bands. And I thought about sort of pulling it down into the middle of this sort of geometric center of solace in the middle of this party where everyone around is just completely sad and despondent, but looking up, and I sort of imagine just releasing it. And this thing in my mind just flew up into space, into the stars, and I was looking up, kind of like Julia Monterosa was looking up at that moment of sadness and of disappointment, where it's just moments before she had been so upset, and then she's crying and in heaven and looking up heavenly. And so I kind of imagine, I sort of thought at that moment, this is sort of like a new beginning where people feel as if they're able to go into a new space from despondency. And as I'm thinking that, I look up and it says 2 new beginnings. Somebody literally wrote that at the launch point of this sort of this hypothetical rocket. So I think this is our challenge here for the next 2 days, is to build a metaverse, not just for gaming and entertainment, but a metaverse that encourages us to look up. Look up. And I mean literally sometimes, certainly metaphysically, metaphorically, when we're feeling down, when we're at our lowest. We need to figure out how to find the ease, in the midst of the dis-ease. That's what we're trying to do in large part in a room like this. And so I want to talk now about a conceptual framework that will help form the last part of my talk. Conscious creatures, we are conscious creatures. Consciousness may actually be the fiber of the universe. There's some real theories about that, but we won't get into that right now. We seek to avoid pain. We want ease. We don't want dis-ease. That's a big part of what we're trying to do. And I don't mean just physical pain, suffering in general, physical, emotional, social pain. But there's also a saying that we're all very familiar with, no pain, no gain. We know that. I run marathons. I currently have a torn iliotibial band because I ran a marathon 2 weeks ago, and I'm still limping around a little bit. That's maybe a little too much pain. But, physically, you exercise, you experience pain to become stronger. But also, cognitive behavioral therapy, there's a lot of work in pain to work through something like that to get to the point where you have less pain. And this is an inconvenient reality of our humanity, is that we have to go through pain and suffering to get to the point where we have less pain and suffering. Think about that for a second, and then think about how we can use those insights to create virtual reality environments that address this issue. So if we think about pain over time, we have some level of pain that we're in. Okay, so I've told you 2 stories where both of us had some form of pain, physical, biopsychosocial. And then almost instantly, we were able to reduce the pain dramatically in a striking way with this sort of aha moment where we felt as if we had some insights about ourselves. But then, of course, it's not like it stays down there forever. It comes right back up again. For the most part, the pain comes back up again. And oh, it didn't work. No, it worked. Don't expect it to work for hours or days. Some people it works for hours. Some people it works longer than that. But it's not like you're going to cure a chronic disease with one treatment of a virtual reality headset. Maybe psilocybin, it does. This is a cyberdelic of sorts. But, we can talk about that some other time. The point is it's going to come back. And this is now the hard work. It's navigating people through what I'll call the no pain, no gain curve. Okay, now that you've had that aha moment, it unlocks this knowledge that you have a journey to go through now. And this is what it looks like, more or less. And so the first thing on this journey is the challenge is to see the unseen, to see that there is a beyond over that hill, and to have a cognitive horizon that gets you out far enough to really visualize and believe that there's going to be a better experience. If you can't believe that, then life is going to be very hard. You have to try and understand that there's going to be a better place. And so there's this kind of point of hope that you have to trust exists to get up and over it. And so the first stage of this is believing in the journey. That's a necessary precondition. I believe that I can get to the point of hope and get up and over that point. And that after I get beyond it, things can get better. Okay? But then there's another consideration, which is you may believe that, but you don't yet have the resiliency or the resources or the strength to get up and over that point. So this is sort of the second part, is hope is a function of belief and resilience. And we need to think about those two components as we're developing therapeutic virtual reality programs. Because if people don't believe, as soon as they feel some pain, they're going to come right back down into that little valley. It's almost like the fable of Sisyphus, where you're never going to get there. You're just constantly pushing the boulder your whole life. That is a catastrophic fable to live with, catastrophic reality. But even if you don't believe that, or you do believe you can make it, you have to have the resilience. So you get almost there, and then boom, you get knocked back down again because you didn't have the ability to do it. All right, so how do we help there? We have to change the shape of the curve. We have to make it, there's still work to be done, but we have to increase the area of this curve so that per unit time, the work is not as hard, but there's still work being done. And so we have to figure out how do we increase the area so that people can get up and over and bring them through that journey. But even when they get there, it's not like they're done. We know that. It's not like, oh, you're done. You did your 8-week treatment. The idea is it's going to come back, but each time, hopefully, there's more skills, more resiliency, more belief, and it gets a little bit easier, a little bit faster, a little bit lower, and this is sort of the progress that people follow. So I think to fight pain, and this could be physical pain, emotional pain, we have to challenge the fable of Sisyphus, and we have to flatten the mountain. And so I want to talk about these two parts and start talking about how we do this with our VR programs and start giving you some examples now. And so challenging the fable of Sisyphus is another way of saying changing your mindset. Many of us are very familiar of Carol Dweck's work from Stanford, very famous, incredible research on the psychology of success. We don't need to relearn this whole thing. It's already been laid out before us how to do this work. Carol Dweck talks about the fixed mindset and the growth mindset. The fixed mindset is the Sisyphean mindset, where challenges are to be avoided, obstacles are something that you just give up in the face of, effort can be fruitless or even worse, harmful, and as a result, just sort of plateau early and never make it. Whereas the growth mindset is the opposite. This is getting up and over the point of hope, embracing the challenges, persisting in the face of setbacks, seeing effort as a path to mastery, learning from criticism, and so on, and reaching ever higher levels of achievement. And that could be measured in lots of ways. So we need to understand how do we embody these concepts within our programs. This is an example of how we do it. You'll hear more about this in a little bit, but this is a program called IBS VR that we created for people who have irritable bowel syndrome. And it's a sort of digital ecosystem. There's a virtual reality component I'll describe in a second. But we also have text messages and push notifications and emails. And it's a 56-day, 8-week treatment program. That's the journey that they go through. And this is just an example of one of the check-ins where we talk about and introduce this idea of locus of control. Some people think they don't really have a lot of control over their lives, that things can't be done to stop bad things from happening. The stars are aligned against them, literally disaster, okay? Disaster. Dis against aster. Stars. Disaster literally means you think the stars are aligned against you. And so that is external locus of control. Like I have no control over the universe. But the internal locus of control, these are people that dig deep, they respond positively and constructively to life's challenges and so on. And so we introduce and start building this concept up. And over the course of time, we ask people to measure how much control they think they have. This is somebody who at baseline a control of 16 out of 100, and towards the end of the treatment program, 89. Feels as if they actually do have more control over their illness experience. And that's the That's the busting the fable of Sisyphus part. You have to believe that, and we measure that and see if it's actually true or not for each individual. So the aha moment, if we redefine it this way, is sort of the moment that you recognize that you do wield internal control over your experience of suffering. We can see it physiologically with Julia's data, where as soon as she had that aha moment, her physiology changed. That's the aha moment. Here are two people at Cedars who are using virtual reality, and you can see their aha moments here as they unfold. You can just turn the sound up a little. Oh, that's good enough. Yeah, we see that a lot, actually. A lot of people that get emotional. Right.
I don't even have the words to explain it. It's beautiful. It's touching that you guys are doing something that's so great. Being in here and being able to just escape what's going on. And yeah, just when I'm like, ooh, I could just sit here, especially on the lake. I'm like, shoot, I can pretend like I got some barbecue. That's all I need. And just chill there all day.
It was really touching. I also want to thank Sochi Liebler, who I think is here somewhere, who's helped with that video and all of our kind of work that we do from an audiovisual standpoint. So this is our cart. I like to call it the aha moment machine. Maybe it's the empathy machine. It was the brainchild of Omer Liron, and you'll be hearing more about how we use this cart in the hospital. This is a tethered unit. We have a clean box in there. We've got all sorts of equipment in there. That's a cooling system that the computer sits on top of. But this is, not curing disease. This is generating aha moments so people recognize this new opportunity, this new opening in the roof above them, so to speak, to the stars. That's what this machine is, as I think about it. And so I want to end sort of by talking about the next part, which is, okay, you believe that you can make this journey. You believe there is a point of hope you can get up and over. We now need to figure out how to flatten that mountain. And so how do we do that? The first place to start is simply ask people. Start with patients, the people themselves who are experiencing the journey. Learn directly from them. How do we flatten this curve? How do we make it easier for you to go through this process? This is about fun. It's not all this business. This is about having a good time, too. And so several years ago, we published this paper, which I'm glad to see the FDA is now reviewing, on this methodology for how to develop and validate virtual reality treatment programs. And just like the FDA has phase 1, 2, and 3, this is VR1, VR2, and VR3. But the VR1 study is the key part for me. That's when you just sit down and actually talk to people. Before you make some assumption about what people want, what they need, what they're looking for, you may have absolutely no idea. What matters are the people who are going to be using this and what their unmet needs are, what's their knowledge, what are their attitudes, beliefs, preferences. That's the human-centered design. This is cognitive interviews, focus groups. There's a whole set of methodology that we described there. And so we go through this process, hear back from what people want. This is a storyboard when we were developing IBS VR. Before we actually go and code anything, we want to find out, does this sound good? We created this cute little robot. You'll see it in a second. People wanted to have fun in this environment. This is Omer Liron actually now taking what we've envisioned in partnership with patients and starting to program it into Unity. And then we do all this voiceover recording. And this is Kate Makaroff, who is one of our medical students about to graduate from UCLA. And turns out she has like a great voice for this My Other Robot that you'll meet in a second. So we have these scripts, so you'll listen to what she has to say in a second, that we've developed in partnership with our patients. And this is an example of us in this recording studio laying down the soundtrack for this program.
Welcome to the conversation room. This is my favorite room in Spaceship Reflection. Here, you'll gain some perspective by moving in and out of your own mind and body. It's actually pretty simple. Here's how it works. You can see a caring and wise friend sitting on the other side of that frosted glass. That person knows a lot about what you're going through and is going to help you.
Nice. Very good. Very good.
Cool.
So we have the script right there. We developed with the patients, goes right into
Next. Okay.
right into this recording studio, and then she records it. She's describing a self-chat room that I'll show you where, based on the work of Mel Slater and others, you have out-of-body experiences and just meet yourself and talk with yourself. So we have a virtual clinic that we've created. Rather than always bringing patients to the clinic, you bring the clinic to the patient. It's a 56-day treatment experience. They go into all sorts of different environments, progressively unlock these rooms over the course of these 8 weeks. And towards the end, we want to graduate people back into real reality. So we have a series of exercises to really start practicing in real life what you've been doing in the virtual reality. What we do in here is give lots of attaboys and feedbacks and biofeedback, and both biofeedback and psychometric feedback. Here's the trophy room. Sounds like you're on a Disney ride, like soaring over California or something. And this is the trophy room, where literally we might as well shoot off fireworks in here. Like, this is you getting through your journey, and you can see the trophies that people will earn as they go through it. They can monitor their scores, their symptom scores, see how they're doing over time. And this is a way just to continually give feedback. It's available on the app as well as within the virtual reality environment itself. If you're interested in that, by the way, you could take a picture of this QR code or just go to vrx.health. And we're going to be beta testing this in the next several months. So you can just put in your email and get on the list if you're interested to beta test. This is a video now that summarizes this 56-day course in about a minute. It's a little hard to do. But when you enter this fantastical clinic that looks like no other clinic you've been into before, it looks like this sort of spaceship space. Here comes your guide, Maya the robot. And you're going to hear the voice of Kate introducing herself as Maya now.
Hi, and welcome to IBS VR. My name's Maya, and I'm a virtual therapist.
This is the theater of the mind, where you do cognitive behavioral therapy, mindful meditation, biofeedback. You can see the vaporous breath. This is a role reversal where the patient becomes the doctor and examines the patient with a stethoscope. Learn all about what's happening inside the body, learn about bacteria in the gut, but also learn about the way that the brain and the gut are connected through what we call the brain-gut axis, which Dr. Lacey will talk more about. Won't even explain what's going on here. You'll just have to see it one day. Practicing what it's like to be in a stressful environment. For people with IBS, being in a public restroom, it's quite stressful, and you can do cognitive behavioral therapy right there in the stressful environment. Learning the steps of cognitive behavioral therapy in different environments within the theater of the mind. Going into the zoom out room, which is a progressive process where we move up into the roof of this building.
You are not alone.
See all these other people with IBS out there, and then find yourself in a spaceship, which is bizarre. Now we're back in the bathroom, which is unexpected, doing cognitive behavioral therapy. And up on the spaceship, you meet yourself, and you talk to yourself. So this is how it works. This is IBS VR, just a little bit of little bit of what it looks like. And we've learned a lot from our patients. We've published a paper on this. So this is actually from an IRB-approved protocol doing cognitive interviews, and that paper is available. I'll show you a link to it in a second here.
Okay, this was fun. Bye for now.
Okay, that's Maya. Thank you. Now, you'll notice the last thing she said was this was fun, okay? So even though I'm up here crying and being emotional, like this is fun, like this is actually fun. So we want to emphasize that again. If you didn't get that QR code, here it is again. You can take a picture of it. So you can check that out if you're interested. We'll be launching that hopefully over the next 6 months or so. It's undergone a lot of beta testing with a lot of patients. She said this was fun, and we know that fun works. This is a famous study from Hunter Hoffman. it's almost illegal to hold a virtual reality conference without showing this slide. And so this was a very famous study from Schmidt and colleagues, University of Washington, people with severe burn injuries undergoing bandage changes. Not a time that you'd be having fun, but they measured fun in the group that got the virtual reality, and look at the difference. I don't know who has any fun at all when you're having, but I guess some people had fun in the control condition too. This is the paper for the study I just described. All right, we're going to be here for 2 days, and I'm going to get off the stage momentarily. But I've been talking a lot about pain and suffering, but I'm hoping this is framing a broader discussion about the future of the metaverse. There are so many other opportunities for virtual reality and extended reality. And this is just the beginning of some of the topics we're going to be discussing today. So if virtual reality is a therapy, we need a VR pharmacy. It's been almost exactly 3 years, March 5th, 2020, just before the pandemic, when the FDA held its first public workshop on what was then coined MXR, Medical Extended Reality. And it was a very interesting group of people there. We were there at Cedars and Hopkins, but look, there was Facebook at the time, Magic Leap, Sony. Very interesting interdisciplinary discipline that we find ourselves in. This is becoming a legitimate science. The FDA is now regulating these treatments. This is an announcement from last year. This is just from a week or so ago. New Medicare ruling providing VR companies an easier path to payment. This is a major story. This is a real science. We now have a medical association that we're going to hear about shortly, the American Medical Extended Reality Association. Join if you're interested. You'll hear more about that soon. This is a list of the NIH studies that we have at Cedars-Sinai alone looking at virtual reality, and there's over 100 now. So this is where we are now with this field. It's a huge difference from when I first stood up on this stage in 2018 for the first version of this conference. And yet, when people think about virtual reality, they think of this, okay? We have to figure out how to expand the public zeitgeist and perception of virtual reality as not just this, but this, okay? Pictures like this don't help anyone, okay, in this room, but we have to figure out how to replace pictures like this, with pictures like this. This is Mary. She has advanced dementia. Moments before this image was taken, she was in the depths of bewilderment, crying out. I'm going to get emotional again because I know what this video is about to show. And, upset with her family members, but then they put a VR headset on her face and brought her back to a beach from her childhood. And it's amazing to see what happens next. She starts to sing.
Gonna see, I'm gonna see, I'm gonna see, I'm gonna see.
Beautiful.
Oh, look at it. You wouldn't believe this was there, would you?
No.
If you didn't come here to see it, you would never know that it's even blue.
It is blue.
Oh, it is blue. Look at that. Blue and white.
So these are the pictures of the metaverse that we want to build. This is a metaverse that supports human health and well-being, not just for gaming and entertainment, right? This is a metaverse that provides harmony, right, with a sense of awe and wonderment and a sense of empathy for self and for others. A metaverse that provides escape, at vulnerable moments when people need it the most. And ideally, a metaverse that allows us to look up at the stars. So that sort of brings us back to our grand challenge here. I'm going to get through this. Which is to build a metaverse that encourages us to look up when we're feeling down. And we have to know how to do this now. We have to understand that emotion matters, escape matters, and awe matters. That we leverage these principles to deliver aha moments that empowers people to challenge the fable of Sisyphus in their lives. And we need to flatten that mountain so it's easier to push the boulder over the hill. And provide tools so that people can internalize their locus of control and feel like they can actually make the journey. And ideally doing all this while having fun. So I've written a book about this. You can check it out if you're interested, VRX, How Virtual Therapeutics Will Revolutionize Medicine. And I want to thank you all for being here. All these people. Yes, thank you. And that's for all of these people too. Our students, our trainees, our administration from Cedars-Sinai, and of course for all of you for being here. And on behalf of Cedars-Sinai, I'm going to stop talking.